to say, okay, let's look at what you're trying to accomplish. Let's look at the bigger picture. What do we want to do here and still, your
Yeah.
bill of materials costs down, keep your architecture tight. What's it going to look like for the next generation and the generation after that? So your certification issues aren't as big going forward.
In this episode of Embedded Insiders, Editor-in-Chief Ken Briota sits down with Martin Smith, Principal Segment Manager for the Medical and Health segment of Microchip Technology. Together, they explore how Microchip supports innovation in the medical field, navigates stringent security standards, and tackles the challenges of certifying new medical devices. They also discuss how advancements in AI are paving the way for improved patient care. Next, Rich and Vin return for another Dev Talk featuring Tim Belotsko, MProof's Chief Scientist, Head of Engineering, and co-founder. The trio delve into the art and science of reverse engineering, sharing insights from the field. But first, Rich and Ken kick off the episode by unpacking some intriguing acquisitions in the computer components industry, shedding light on their implications for embedded computing.
Well, hello, friends out there in the internet, engineers, developers, et al. Welcome to another episode of Embedded Insiders. I'm Ken Briota, your editor-in-chief of Embedded Computing Design, and I'm here with Rich Nass, our VP of everything that is cool and powerful at Embedded Computing Design. How are you, Rich?
I'm good. I didn't know if I was part of the et al.
No. The et al is the listeners. They're et al. Because it takes too long for me to list them all. That'd eat up all our time, and Tiara would have to shank me. So I ramble on enough as it is.
Okay. All right. What's new?
I mean, look, we were going to talk about a lot of things, but the only thing that anybody's talking about is Silver Lake taking a controlling interest in Altera, right? I mean, that's the big thing.
Is it them taking controlling interest in Altera or Intel getting a lot of money to potentially revive their company?
I mean, I don't know. Here's the thing. That's how Reuters has framed it from what I've been reading, and I don't think that's a bad take. It looks an awful lot like Intel is struggling, and that a big cash infusion like this, what is it, $4.5 billion or something like that?
Something like that.
4.46 billion, yeah. To get 51% of the company, which, I mean, here's the thing. It's an interesting, if you look at it from the point of view of Silver Lake, to me, it's an interesting purchase because Silver Lake is invested in a lot of tech anyway. You know, they were one of the big funders behind when Michael Dell rebought Dell. They're invested in Waymo and Airbnb and a bunch of other, major tech companies. So like being involved in the space isn't weird for them, but it's weird for them to make a play at a company that everybody's got, not everybody, I'm not going to make broad generalizations, but some question marks about exist, I think, both from Intel and Altera, right? Like people don't know where their roadmap is right now.
Well, up until a few months ago, I probably would have agreed with you, but and now I don't know what to make of it. But Sandra Rivera had them on what I thought was the right course, and the people were pumped. The product rollout made sense, and all of a sudden we hit this weird turn where she's out. There's a new CEO, and who knows what to think.
I don't know very much about the new CEO either. I don't know if you know anything about them, but
he has a little bit of a history with some of these companies, but and it isn't even so much about him. It's that replacing her at this point in time. I mean, she knew herself.
Yeah,
and I don't know. Maybe there was stuff going on behind the scenes that we don't know about. That that.
I mean, who
wasn't
knows?
The right direction.
The problem is, it just, no matter what the reasoning is, to do these things all in such quick succession, I mean, I don't know whether it was a divestment or what it was when Intel split Altera away, spun it away again, then the new CEO, then another new CEO, then selling 51% to Silver Lake. This rapid succession of things in 6 months just looks so unstable. Like,
Yes.
It's the shareholders have got to be concerned. I mean, I'm sure they've been in conversation with the shareholders throughout, because they have to be. But like, it's really hard to make a lot of conclusions here, because it's really hard to see what's going on, other than, as you said, Intel really wanting a cash infusion to shore up what I assume they want to build up on their foundry. That seems to be the biggest, most impactful play they could make, to me. Like, I'm no expert, but I don't know.
I probably agree with that. I hadn't thought about the foundry part of it, but there's some sense to that. And when you start talking about foundries, $4 billion is not a lot of money anymore.
It's true. It's true. But with the economic situation globally, and like nobody really knowing what the tariff situation is going to land on, how that's going to impact semiconductor imports and things like that. Intel being one of the major US based foundries, it could be a big boon for them. And if that's going to be where they play, then maybe that's what the thinking is. I'm not sure.
Interesting. Well, it's one of these we'll have to wait a little while, let it play out. I mean, it's brandy new, so
Right.
I'm sure they'll have an interesting spin on it, and we'll hear that, and then we'll come back and make our own informed decision.
Yeah. Well, I mean, their spin in the announcement was they sort of did a dual announcement with the uh new CEO Raghib Hussain, and they framed the 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 deal with Silver Lake as a strategic investment by Silver Lake in Altera in the headline, which is an interesting framing for in the press release. But Intel is going to continue to own the remaining 49%, according to this. They're not saying that it's going to be that they're going to be further selling pieces. I mean, who knows in the future? We'll see. But one thing that's an interesting number piece of this too is that Intel originally bought Altera for 17 billion, give or take, pocket change here and there, back in 2015. And this deal values Altera at just about 8.75 billion.
Well, that goes along with my strategy of buy high, sell low.
I mean, you're not wrong. You're not wrong. But but it's just, I don't know. I'm having a really hard time. Maybe we need to bring an investment banker on as a guest at some point to talk about what the background reasoning for this could be, because you'd think that Intel could make that same amount of money and maintain control by just leveraging the asset to gain cash, rather than selling more than half of Altera. Like, there are different financial situations I feel like they could have negotiated if they weren't trying to not have the asset under their control. I don't know. It's all speculation.
Yep. I suggest we wait maybe 8 weeks or so, and let everybody get their say in and see if it makes sense.
I wonder when their annual shareholder meeting is, because I assume it's going to be a lot about this.
Yep, for sure.
Yeah. Well, I think the rest of this episode that you folks out there are about to listen to is not about this at all. So enjoy the rest of it, and don't forget to subscribe. We'll see you soon.
Now, here's Martin Smith, Principal Segment Manager for the Medical and Health segment at Microchip Technology.
Hello, engineers, developers, friends, and foes. Welcome to another episode of Embedded Insiders. I'm Ken Briota, editor-in-chief of Embedded Computing Design. And I'm so excited to be here with Martin Smith of Microchip as my guest. Martin, welcome to the program.
Thank you, Ken. Appreciate me being on.
It is really my pleasure. Today we're going to be talking all about some healthcare stuff and medical devices and some of the work that you guys have been doing in that space. But before we jump into that, do you want to tell our listeners anything about you in particular? Any fun facts or tidbits that you want to go publicly on the record with?
Oh, okay. Well, since it's on the record, no, I'm just kidding. Actually, My role here is managing the medical segment for the Americas. Although I've had over the years at Microchip, I've done various efforts in medical globally. I've been doing it for the medical part of this since 2011 here at Microchip. And the idea here is basically working to what is our direction as far as serving our medical customers, those who make medical devices, supporting our field, supporting our customers, working to determine direction. So we better do a better job at that overall. So that's kind of
Yeah.
what I do, and that encompasses a lot of things. So I wear a lot of hats and move around a whole lot.
Medical and healthcare is such an interesting space. I've covered it on and off for years. First with in the IoT space, talking about devices and connectivity and stuff. And it's been a minute. Although embedded computing design has always had a little bit of medical and healthcare coverage. So bring us up to speed a little bit. What types of medical devices are sort of part of the medical device market now? Years ago, it was wearables and home health aids and stuff like that. What are we dealing with these days?
Well, you've still got some of those, and probably that area has grown even more since then. With the COVID, it accelerated a lot of that. But you've got a lot of different areas. I mean, if we put it generally speaking, you've got areas in clinical, portable, like you said, wearable, even implants such as pacemakers and neuromodulators, things like that, and other types of what they call FDA Class 3 devices. And for those, I mean, a lot of folks probably know this, but the classifications the FDA does are for safety reasons. So Class 1 being the least risky or not as many safety concerns. Class 2, about mid-range. And that's probably where most of the electronic medical devices sit, is in the FDA Class 2 space. And then there's Class 3, like I mentioned, for things that are implants, the pacemakers, neuromodulators, anything that's life support, life critical. And so you see a wide range of devices in that space.
And are those classifications, the parameters are both in terms of obviously safety in use, but also security, right?
Security is a part of it. The FDA has been working for a long time to upgrade their security standards and what they will do to certify a new medical device. They had a guidance document they issued many years ago, and finally it became finalized and went into force in October of 2023. Their cybersecurity guidance document, and so that's a big part of it is security. So it's relatively new compared to the normal risk assessment and pre-market evaluation and post-market support that FDA has always done for medical devices. But it's been around enough years now, and definitely became regulatory required starting in October of 2023.
Absolutely. And for our listeners not in the U.S., which we do have some, do you guys work in? Because I know the regulatory structures obviously are different for the EU or in China and parts of Asia and that kind of thing. Do you guys also work in that regulatory space?
Definitely, yes. And we've got different folks at Microchip throughout the globe, basically, that are also medical subject matter experts, like we call ourselves, basically, for the company. I've got, somebody who handles Europe for the EU MDR, handles all of the, familiar with that. And then we've got different locations throughout other parts of the world that have their own, regulatory approval process for medical devices. They all kind of started out similar to the FDA, so there's still a lot of things in common, but there's been variations over the years. EU in particular is kind of going their own way in some respects, but the basic premise is kind of the same, and just how you go about it might be a little different.
Of course, I know the EU focuses very heavily on the privacy side, so that becomes a challenge. But let's stick to the U.S. for now. You mentioned the FDA Class 3 and that Microchip supports those designs. Can you tell us a little bit more about that and what makes the Class 3 such a challenging space to work in, and how unusual it is?
It is somewhat unusual because, again, of the safety critical nature of it. We have, as a company, we have embraced going to be able to support Class 3 designs with our customers. The quality, the experience we have in the medical space for so many years really supports that. So when we've heard that, maybe sometimes our customers had a hard time getting other suppliers to support them on a class 3 design. We've been able to work with them and be able to supply the parts and give them the support they needed to go ahead and get that product out to market.
Yeah. The landscape of medical devices has certainly changed, and I'm curious about how that change has happened, and sort of why with respect to this sort of implant infrastructure, because little by little we've got more and more of these implanted devices, these what FDA calls class 3 devices, becoming, I don't know if I want to say commonplace, but certainly a less unusual class of treatment. So how is that changing sort of the scope of what you guys do in medical, and what the medical device industry is like?
Yeah, the class 3 is definitely still a minority, although like you said, it is growing. There's more and more opportunities. There's some great solutions out there. Uh, One of I think the most satisfying parts of my job is when I get to hear about people who are positively affected by any type of, diagnosis or treatment from a medical device. The ones who get the implanted devices, those are really great stories, and
Yeah.
it's really kind of neat to be, feel like, okay, we've been a small part of that somehow, as far as supporting the our customers who make the devices. But, overall, if you look at the landscape from the 10,000-foot level, a couple of things have happened. It's been ongoing for quite a while, even before COVID. Um, Things were happening as far as the remote monitoring and telehealth space. Areas are growing, looking at security, things we mentioned and talked about a little bit before. But one of the, a couple of things that happened, COVID kind of took a lot of that and accelerated a lot of that was happening.
Sure.
One of the things that happened in healthcare was, remember what we call the Great Resignation? Healthcare was hit pretty hard by that. It was probably the number 2 industry that suffered with people leaving the industry for good,
Yep.
and they had a hard time replacing those people. So that in and of itself meant that, what do you do without the people? And so they were trying to say, how do we fill that gap? When you talk about in hospitals and clinics and doctors' offices, how do you fill that gap? And they're trying to do that with technology. Again, it has to be safe, FDA cleared, be safe and easily usable by maybe, and before maybe the equipment had to be used by, a specialized nurse or something. And now you've got someone who's a technician or a little less training, because the device is obviously set up to be safer, more user friendly, and definitely the advent of AI coming in to be able to handle a lot more of that. So that's one demand that's been put on the industry overall, and demand for those who make medical devices. And so we see a lot of that changing since COVID, trying to fill those gaps and fill those needs. The other thing that's interesting, again, it was happening before, and COVID seemed to accelerate a lot of issues around it, was just getting healthcare out to more people, whether it be governments or businesses or charities. There's a drive to get more and better healthcare out to areas, especially the areas that are underserved by doctors and full hospitals and things like that. You got areas that are in almost every country. There's rural areas that don't have that kind of service that you would in bigger cities. There's also developing nations that don't have that, haven't had that advantage starting off with. And so that whole area of remote healthcare, call it telehealth or telemedicine or remote patient monitoring, things like that, actually was accelerated by COVID. And although it's not probably getting as much press as it used to, there's still a big push going on to get healthcare out to as many people as possible. It's kind of an important thing. And so as you do that, the demand for the medical devices increases, the demand for the connectivity, the security for those devices also increases. Ergo, we have the FDA and the MDR. The FDA with their own Cybersecurity Act, the MDR is following the EU security standards, and so forth. So there's a lot changing, a lot more demand for our customers. So the area is really growing. I mean, if you look at that piece of the pie, that part of the market, this, I guess, a sub-market within medical, it's amazing how it's growing. Usually you'll see some markets growing, 5-10%, as far as, what's the demand for medical devices. In the areas I've been talking about, though, the demand is in the 25 to 30. And I've been watching some measures go from like the 28 to 35% growth areas over the next few years. So it doesn't seem to be stopping, and the demand is there. So that's some of the biggest changes I think I've seen overall in the healthcare space, especially for medical device demand.
Yeah. It's interesting because the telehealth, remote health piece of it, 10 years ago was the driving force for connected healthcare and embedded technological health, because again, those rural areas, those underdeveloped areas were desperately in need. And it's interesting to hear you say that that's also still a big part of the industry, if a little bit unsung. Um, and uh, that's very cool to me. I'm curious, and this is a non sequitur for sure, but the regular listeners will know that that's the name of the game around here. um, is do you have any thoughts about sort of the transhumanist folks, the folks who like do the NFC implants and the almost recreational medical devices? I guess, I mean, I don't know. I'm sure you guys don't dabble there, but those are much less regulated than anything that's being put in officially anyway.
Yeah, it's it's not an area we typically are involved with, and again, like you
Yeah.
said, not as regulated. For all intents purposes, we looking at what is the FDA involved with, what are we doing, and kind of
Yeah.
that mainstream. Like you said, there's so much demand, and the the benefits really that outweigh that. And as you mentioned, like I mentioned before, it's still ongoing to get healthcare out there. It's not as much press. The press is more in other areas right now,
Right.
understandably so. What's new and interesting, and keeping track of that. But there's still huge needs out there for standard stuff. Now, one of the big areas, obviously, AI is driving a lot of it. That's getting the press, and that's obviously,
Oh yeah.
again, changing even that remote monitoring, telehealth, and those areas, as well as every other aspect of medical devices and healthcare delivery.
Absolutely. And I think that especially in an arena like healthcare devices, no news is often the good news. The reporting usually happens when there's something we don't want to have happened, um, which segues beautifully into talking about security. Obviously, it's important for medical devices, and our listeners are mainly, design engineers and developers and that kind of thing. What should they be thinking about when it comes to security, hardware, software, in medical devices if they're working in that space?
Yeah, a lot of it has to do with history. Companies that are large and have a long history of how they handle, security, for example, cybersecurity, they have certain methods. They've gone to the FDA in the past, and some of those will still work for them. Others maybe not, depending again on the products they've got. Are they newer? Are they different in the market than what they put out before? What's already out in the market? The predicates, the 501k certification, 510k certification, excuse me, um, for so it depends, is what I'm saying, is it depends a lot. But some of the things that have come out from the cybersecurity guidance that the FDA gave recently, well, back in October when they finalized it, as well as some things that have come out. The one thing that came out from the original October release of the guidance, and it was in there before, but the actual release was that the FDA is actually encouraging designers to move from software-based security to hardware-based security, hardware element-based security. Again, not a requirement, but an encouragement depending on the device. And
Yeah.
for example, I can see many medical devices in a hospital, infusion pumps or things like that, and or different type of devices that are connected on a network, and they generally may go to a server before it goes out to the general hospital, network. And the server, among other things, is handling all the security. So there's a software security element that's been kind of traditional in many cases, not all, but in many cases. And the push in many cases is to get that down to the area where you're putting hardware security elements into the device, the medical devices themselves. Um, and we're seeing a lot of that. There's so many advantages to that. Actually, in the long term, cost wise, although it depends on your software development versus your hardware development, how much does that cost? And then
Yeah.
obviously you're adding some more maybe to your bill of materials, but a lot of these features either integrated into the MCUs themselves or separate hardware elements you can add to a design and and so there are cost-effective ways to include security to existing designs, as well as taking a hard look at new designs and how you can integrate the security. That's at Microchip, we have a long history of supplying security to a lot of different industries, and so we got a good basis there, and so we get to see a lot of what's happening in different market segments. And I've seen, of course, with medical, how the healthcare industry, the medical devices, are more and more implementing that security, as the FDA has been starting to talk about us several years ago. And but again, I think overall, again, depending on application, but a hardware security-based solution, there are cost savings to some degree depending on how you design. There's definitely, I think, better security in the long run. Some people will debate me on that, but my thoughts are we tend to see a little tighter, security and handling it overall. So that's a big thing.
Yeah.
As far as the software end of it, the FDA has come out after the guidance and started emphasizing things about software. So the application software along with the security software, and looking at things like what they call software of unknown provenance, SOUP is the acronym, and using third-party software, or how you handle your software lifecycle development. Looking at things like software bill of materials, especially if you're doing you're building, you're using the devices, you're running an operating system versus a bare metal firmware design. And so those are things that the FDA again is emphasizing to look at, and you'll have to have the software bill of materials, for example.
Right.
What's your Linux build look like, or what do your other software elements look like, things like that. And so again, we part of the thing, we do as far as with our software, the firmware code we give, or the partners with the operating systems, whether it be an RTOS or Linux or whatever, is supply everything that they're going to need to meet those requirements. One thing that is helpful, I think we're going to see more of. It's been kind of on the back burner for a lot of companies that design medical devices, but for firmware development, one of the things that helps with that is following the international standards. IEC 62304 is the software lifecycle development standard for medical.
Yeah.
It's been talked about, bandied around. You don't necessarily in the past have to have that, but showing that you're following those software, your testing, your maintenance, your post-market support, all of those things, it gets me more interesting. And I think it's a one good way to kind of go towards meeting the FDA requirements. I know we look at that along the lines of a functional safety compiler setup, and that's certified. So our customers in firmware development can have a compiler that's already 62304 certified. They can use code libraries from, say, IEC 61508, the industrial standard, or even to be even more safe, the ISO 26262 standard for automotive, which can be used for possibly more life-critical type applications and devices. So there's a lot of different aspects to the software security piece. But basically hardware elements overall, something to look at and see if that makes sense. It's I think it adds some benefits for the long run. And then as far as software bill of materials, your software development environment, because both security and then in AI and stuff, one of the prerequisites, how are you going to support this in the long run? What's your post-market support going to look like? How can you keep your system secure? Does your AI get out of control? Or if you got that under check, that's something the FDA is pushing in both of these guidance documents when you look at them. So that's pretty typical for the FDA, but I think it's one way to look at it, and they're being pretty consistent in giving us that look. Although some people who've gone to FDA will argue about consistency, but that's another subject.
And you've talked about AI a couple of times, and I'm going to delve into that. But before we leave security, security is always a moving target. Obviously it's a never-ending and never stopping battle. But do you feel like the security standards have been keeping up well in healthcare with what needs to be done in a security, from a security point of view, or should you really be trying to exceed and surpass those standards as a manufacturer?
That's a good question. It would be nice to exceed in some ways. I think, though, the FDA's guidance and the overall EU security standard that's being worked on are pretty thorough in that respect. And so the question is, what can you do over time in a cost-effective manner as a business when you're designing medical devices? What can you implement? You want to meet the standards, obviously. It's a requirement, and overall, you'd like to meet it because you'd like your devices to be safe. There's that aspect too. So it's been a challenge. I mean, I think our medical device folks overall are keeping up rather well, and it becomes a point of, gee, how safe does my thermometer be versus my pacemaker? Well, obviously that's kind of extreme edges of that question, but you have to
Right.
look at what you're designing and what you got to deal with.
Right. Yeah, that makes sense. So let's talk about AI. I mean, obviously, the AI and machine learning elements are getting involved in every aspect of embedded these days, and healthcare is no exception. The medical devices are becoming smarter. This um, absolutely impacts every aspect of operation, from interaction with human, healthcare professionals, and how patients and those healthcare professionals interact with devices. And of course, it will impact security and things like that too. So how has the regulatory sphere and the FDA in particular been certifying the AI elements in particular? And are there specific design choices that engineers and designers should be aware of when adding AI into these systems?
Yeah, that is it's still ongoing. Like I said, the guidance document the FDA came up with is open for comment, and so things may be changing. But the initial document, the idea is to have developer input, those who develop AI engines, AI solutions in medical for their devices, and also some examples of things that have already been certified that the FDA has already certified for medical devices. Um, Last count, as far as I can find, this may have been updated, but it looks like there's about 1,000 AI-enabled devices that have always established what the FDA calls pre-market pathways. Basically, they've been certified and are in that process. Um,
How many of those are microchip devices?
that would be medical devices, meaning medical equipment.
Oh, okay.
Suppliers aren't under that guide. Don't have to do FDA. And that's
Gotcha.
actually it's a good thing for our medical device customers, because we'd all have to come up with our own FDA groups and all that kind of stuff, and it'd probably be a lot less suppliers to medical device companies. So,
Sure, yeah.
yeah, the term that most of us use in medical, when we talk about medical equipment, is medical device. I know
Yeah.
in semiconductors we call our parts devices too, and I try and make that distinction. So I'd say our parts maybe, or our solutions for semiconductor and software and stuff, but
Yeah, yeah.
um, so, um, so to be aware of, well, let's look at a couple things. What are the types of devices that have been medical devices that have been approved so far? Generally speaking, one of the big areas has been imaging, like radiology, things like that.
For
The need,
diagnostics, you mean, or just for image clarity and that kind of thing?
well, I mean, most of the imaging, I mean, there are therapeutic, but most of the imaging is diagnostics, and
Well,
basically
yeah.
the idea is that it's you can do a lot of different things, including enhancing the image to make it easier for the radiologist to make the
Yep.
diagnosis. I know I've done some research, and radiologists are, there's a lot they're trying to do more with less, like a lot of us, and so getting a lot more of the images through to get those back to the referring physician, so they can the referring physician can give the diagnosis to a patient.
Yeah.
And it helps a lot to have certain areas that to be enhanced in different ways, so it's easier for the radiologist, and the AI can even make recommendations. Now, what we don't want, and some people were trying to do at one point, was just let it go total, AI gives it
Right.
and it bypasses the radiologist, and then the FDA said no, can't do that. And that was, I think, pretty isolated instances of somebody trying to pull that off. But
And
overall,
wise, I think, of the
oh
FDA. I don't
yeah,
think we want to
definitely.
cut the human out entirely.
Yeah, exactly. I kind of liken it to autopilot on an airliner. Um,
Yeah.
Basically, when you're on an airline flight, the pilots generally aren't flying the plane. It's on autopilot.
Yeah.
And in fact, technically, the plane can land or take off on its own, take
Yep.
off or land on its own. But generally, landings will oversee depending on what's going on. Give the first officer some experience. The captain makes sure the first officer gets experience, something like that.
Yeah.
But
Yeah.
a lot of the time, it's the autopilot, and I think the same thing is true, that the AI just makes the job quicker and easier, and enhances, and less likely to make mistakes. And the radiologist can make part of the diagnosis, and send it on the referring physician.
Yeah.
So the imaging area has been huge as far as that, and it's starting to break down more. A lot of times, all those images were shipped off to a server to do the AI processing. We're seeing some pre-processing going on at the device level to offload the servers for
Okay.
just more of a kind of an edge approach, if you will. If you were to compare your data system in a hospital to the cloud, even though it's
Yep.
not, but you've got more compute going on the edge, meaning at the medical device, and then before it goes over to the server and into the network and such. So more pre-processing, for the imaging, video for like endoscopy and other surgical and examination scopes. A lot of
Right.
pre-processing opportunities there for video imaging and regular other types of medical imaging. Other areas, cardiology is kind of cool. As far as detecting heart issues, which is really good because those can be a little tricky sometimes.
Sure.
Ophthalmology, I think is great. Eye scans and
Oh,
things
that's
like that,
interesting.
and for that, dermatology even, which is interesting. So I look at that. Even a little bit in neurology, although not as much. But that again, over time, as things evolve, I imagine we'll see other areas. I think one of the areas it's starting to emerge, I think, is patient monitoring again. More and more, there's a lot of things you can do. For example, with that, it's higher processing capabilities and AI engines and models being done is one. You can start looking at personalization of vital signs, meaning, like for example, I know we do a lot of medical reference designs and like ECGs, pulse oximeters, blood pressure meter, some of the
Yeah.
basic type stuff, right? So um, I know, and my cardiologist says I'm healthy, but you look at my ECG waveform, it's different than the textbook one.
Right.
And so, if if someone looking at it says, "Oh my gosh, what's wrong with this guy?" And but if it's already been personalized with AI, says, "No, we've got a lot of readings, we got a lot of data from him, he's fine," or then something varies afterwards and says, "Well, maybe you should go see your doctor," right?
Yeah.
And that kind of thing. And so we see, for clinical type stuff, you come in, you get the thing done. But when you get in the areas of, gee, do I have somebody in the home, someone with a chronic cardiac condition or somebody who has just been released from the hospital and they're going to wear, Holter monitor with a newer type of ECG device that's more AI driven, for example, or other vital signs measurements are going to know and, have learned your vital signs signature profile, if you will, and
Right.
be able to, give better decisions to the attending physicians and such, the physicians that are taking care of the patient. So, um, it there's a lot of areas, and there's a lot, and that's just one example. So we see with patient monitoring.
It's interesting. I think that that sort of personalized data and profiling that the AI systems can allow is really probably the most powerful execution of AI that we're sort of able to start seeing right now. I think that that's going to lead to better diagnostics, better care in general. Obviously, it leads to, a greater need for information security and privacy security and all that stuff, but that sort of comes almost like cost of doing business in healthcare anyway. You've got to even beyond compliance with HIPAA and the like around the world, you've got to protect that data, and healthcare is better at it than most.
Thank goodness.
Yeah, absolutely. But I think it's really exciting and really cool. So, what should the engineers and designers out there be thinking about as they're looking to design in the healthcare space, especially if they're going to be leveraging AI or ML in a medical device? What are some of the pieces of that they should be thinking about?
Yeah, and it's interesting. There's again a lot of press, rightly so, and there's a lot of activity going with some of the higher end AI functions. You look at companies for NVIDIA, for example, great stuff going heavy into healthcare, and
Hmm.
we work with them as well, and so great stuff for them. And so they've got a lot going on. Your own development systems, you work it down to GPU stuff and your learning models and such. So there's a great area there. um, there's also an area though that sometimes gets a little confusing as people start entering into doing AI for medical devices, and that's like, how much do I really need? How much power do
Yeah,
I need? Sometimes you could say, well, I guess I need to, spend all this money on the high-end system. They may not need to, given that. Keep in mind, we focus on the compute engines a lot of time. But again, if you start breaking up designs and saying, do I really need full on GPU? Do I need this? Or can I break it up? Do I pre-processing AI before I ship it off somewhere else? Can I do that? That could be more
Right.
cost effective and better security, things like that before you ship it off to the cloud or to, onto the main hospital, system data, their server systems and such. So there's a lot of different ways to look at that. And
I
so
mean,
a
and
lot of,
power management's important too. Obviously,
oh yeah,
your fingertip pulse oximeter probably needs to be pretty power efficient if it's going to be an effective device, because you're not going to have it plugged in all the time.
right. No, that's a good point. And so a lot of these, devices that are going to be, that are, battery operated, again, wearable, portable. And I think we're going to see even more of those coming out over time for all the different reasons we've talked about. But
Yeah.
again, implementing more and more AI to one degree or another. Um, and you mentioned power. It's interesting. Another way to look at the power issue is the fact that, if hospitals have to start building huge data centers to handle everything, that's not going to be
Yeah.
efficient for them either, because you got to involve with how much power are you drawing, how much cooling do you have to do. And so again, it's that typical edge model. If I'm doing more compute on the edge back at the medical device, again, there's benefits for that too.
Of course.
Uh,
Although the big conversation, I just came off of the CES Embedded World and NVIDIA GTC travel cycle. So all of this is pretty front of mind for me. And one of the big conversations has been about data center energy efficiency and all that stuff, because places like hospitals that haven't typically been thought of as data centers are going to have to become so. So it's an important point.
yeah, and it just needs to be a balance. I mean, there's a certain amount of upgrading data center capabilities in a hospital or other environment like that. But there's also going to be more, what can I do in the edge? And that will involve, even on a wired network, there needs to be some kind of security.
Oh
It
yeah.
helps. Yeah. And, but how can we be more efficient? How can I handle the power distribution throughout my hospital system better? Am I, again, is my device, how much AI, how much, whatever I'm going to have at the edge, computing power.
Yeah.
And so the trick on computing power is that we tend to think a lot about, oh, how much computing power do I need? How much do I got? I've got to train my AI models and such. And it really kind of depends. Interesting thing about it, we've got from our experience, what we've done, we've got a wide range of product from 8-bit MCUs. We've got a 16, 32-bit MPU, 30-bit MPUs, MCUs, 64-bit MPUs, excuse me, FPGAs with SoC, 5-core like things, or quad core 64-bit. Like I said, we've got a wide range of stuff that we offer to our customers. Our semiconductor product, like you said, not devices, but product. And and so, looking at that is we've got AI development tools across the board for all of those. How are you going to develop your AI? So as far as getting the model set up, how, and then before you train them, how are you going to set that up? How do you implement the code? And then the other aspect is, besides the compute engine itself, what's the overall? I mean, you've got a lot of peripheral things to keep in mind. Some of them are integrated into the, MCU, for example, but if you're using high-end MPUs, historically not as much integration. So what is my mixed signal, my signal processing? A lot of times you got sensors out there, and I've got to be able to do signal conditioning. Again, some of that can be integrated, sometimes not. You got to keep that in mind too. What do I do with the signal to have a viable signal coming in? And it's just getting noisier out there. The more you go and look at tissue noise and what's going on with capillaries, when things look at heart rate, but more and more we see a lot more noise as we look in the human body. We got to eliminate that noise as we start to get measurements in different ways, and going from, say, invasive procedures to non-invasive procedures, like photoplasmography. We see in pulse oximeters, that kind of thing, expanding into other areas. And I know a lot's been going on academically with looking at different wavelengths of light, how we can utilize that and the tissue, having the light go into the tissue like the standard pulse oximeter, but looking at other wavelengths of light. What other things can I determine? A lot of academic work, a lot of press, but things are finally starting to actually come to fruition and become real, slowly but surely along those lines. So how you handle the signals from your sensors, obviously, your connectivity, whether it be, we see the Bluetooth space for Wi-Fi, or for medical or portable and wearable and, home health, things like that. You see the Wi-Fi. Security, we've already talked about a lot, but you got to look at, again, hardware security elements. What are you doing for software security support for your operating systems if you're using those versus bare metal development? and the models themselves, the development tools, what are you looking at, and then what's your support for all of that as far as how are you going to interact with your suppliers and their offerings and things like that. So, I mean, I can go, I saw this really cool, compute engine and I really want to use it, but looking at what's the overall design going to look like, what's the software development cycle, what I look at, we always look at the supply chain guys are looking at bill of materials cost overall, and I look at support too for long term. What's that support going to look like? So, again, that's the thing, and we're trying to do basically, and I think we do a pretty good job of all of that, leaving those who design the medical devices, our clients, basically with, okay, what's your, you do your actual board level design, you do your application software, you go through certification, and we'll try and give you as much as possible to support that along the lines we just talked about. So those are big considerations as far as that. And again, just watching out, how much compute power do I really need for this application? That's kind of the big question these days. You got the money, buy the big one, but I think there'll be some supply chain person or some manager up the line who will say, maybe better really look at that. So.
Yeah, I think you're probably right. And man, there's so much to talk about in this whole space. We barely scratched the surface. I mean, we haven't talked about connectivity very much. We haven't talked about smart hospital or any of the pieces industry that we could have. But this has been an amazing conversation, Martin. So I'm going to leave you with the last question I ask everybody. And that's, what did I forget to ask you? What haven't we talked about yet? That's really important for our engineers and designers to come away with when they're thinking about these topics.
Yeah, I think we've covered a lot. I'm just trying to cover a lot of ground here on this thing. I think the main thing as I see it is, since like myself, my company, we spend a lot of time supplying medical, is just looking again at the architecture. I mean, it's on the one hand, the challenge when you're going to FDA is, gee, I've already got a device I've designed that's really similar. It's a lot easy to go through certification because the predicate's already out there. Either somebody else designed one or I've got one. And how do you support that model versus I've got to innovate. I got to add AI. I've got to up my security. And how do I do that kind of thing? So I think this is gonna sound obvious, but it's interesting that I bump into this is, taking a look back at architecture. I mean, with even design, even just a quick look to make sure. The thing I tend to bump into is that, we'll go into a client and or customers. We call them clients too because we're trying to do the big picture with all of them and help them out. But we start talking about their, what's going on, their design needs, and some of the questions will come up and we'll start going, well, let's see, what were you trying to accomplish? What was your overall goal? And it's like, well, we're doing this, this, and this. It says, okay, back at your architecture level, here's, what you're trying to look at. And so it's funny, we end up going back to the architecture level. We may not have thought we were going to do that when we start our discussions, but, to take a look at that. And that's where I really think we end up there so many times. I like that area to say, okay, let's look at what you're trying to accomplish. Let's look at the bigger picture. What do we want to do here? And still, keep your bill of materials costs down, keep your architecture tight. What's it going to look like for the next generation and the generation after that? So your certification issues aren't as big going forward. And so I think that's a key. Again, it kind of sounds silly. You think, well, everybody knows that. They know what the architecture is, but sometimes it's just, there's a lot of pressure just to say, what's the next design? Let's just crank it out and do it. And just take a look back and at least a little bit of a milestone, say, okay, where are we at? What are we trying to accomplish? And along those lines. So issues, I'm trying to think of anything else. We covered AI, we covered security. Camera and graphics is a big area also, as far as I mentioned camera preprocessing, the video preprocessing going forward. I mentioned, again, graphics, support as far as making those screens more easier to deal with. I mean, as we move from more, highly trained medical practitioners to, I've got a technician, I've got a medical assistant running doing around in the hospital, running vital signs. So the graphics need to be, a little tighter, a little more intuitive, as well as just the AI backing it, saying, this is going to make it a lot easier and still be safe.
Yeah, and I think the only thing I'd add to that is that, especially in low tolerance for error space like
Oh
healthcare
yeah.
and medical, the roadmap is important. Knowing, for regulatory issues moving forward with new products, but also just being able to be sure you know where you're going and how you're going to develop is probably a critical factor.
Yeah, it is. And like I said, the guys with less experience, the big medical guys, pretty much have a lot of that going, figured it out. But it's always good to go back and, take a look at it. Those medium-sized, smaller guys that are, branching out to maybe they've got experience with medical devices, but they want to branch out into a different medical device that they haven't done before, or, you know, I say getting into the business. It's a little harder to say that, but there are companies obviously that are innovating and working in
Yeah.
certain aspects of that, so they can get into healthcare more. So all of those things the answer is a little bit different for each of those, but keep in mind we're just trying to say what's the commonality, what can we address and look at as far as the big picture. And some questions you go, yeah, ask the question we've already covered, great, move on. Or some questions like, okay, maybe we do need to take a deeper look at that. So
Right.
that's what we're trying to accomplish.
And of course that always happens with new innovation and things. There interactions that were not necessarily predicted but definitely taking place. We
Oh
need to plan
yes.
for those. Martin, thank you so much for joining me today. This has been great, and we may have to do a sequel because there's so much to cover in this space.
Now, here's Tim Blatsko, Chief Scientist, Head of Engineering, and co-founder of mProof.
Good afternoon. Welcome to the Dev Talk with Rich and Vin podcast. How you doing, Vin?
Great, Rich. How are you?
I'm doing good. I know the audience can't see us, but you're looking quite chipper this morning.
Well, thank you. So are you. Must be that health ring you're wearing.
Absolutely. Well, I don't want to get into the health ring yet, but that is what I want to talk to you about because it's a pretty cool thing.
Cool.
What's going on in your part of the world? I hear about some not so pretty weather.
Yeah, we've had a few tornado watches and we're sitting there watching the news and they have these little arrows circling and they get smaller or bigger. And if they get too small, it turns into a tornado and there's just way too many computers in the world. I mean, there was a time when you looked out the window and decided whether you should go to the basement or not.
Well, didn't all those people who tell you where they're supposed to go to the basement, didn't they all just lose their jobs in the last couple of weeks?
Some of them did, yes, for sure. Not the local TV casters, though.
Okay. So do you have a basement in your house? Is that your safe
No,
room?
we have a crawl space, but we have to go outside to get at it, so it doesn't really matter. It's interesting. Driving down the street, some people had their garage doors
hold on a
open.
second. So you're going to tell Gail to go outside and then go into the crawl space. I want to be there for that conversation.
No, we've found a couple of spots in the house that we're going to go to. I mean, unless you're worried about the house being lifted off the foundation, the only thing you really need to do is worry about glass breaking and getting hit with shards of glass. So they tell you if you can't get to an underground, get to an indoor space where there's no windows and you can close the door. And
yeah, that's what they told Dorothy too.
That is what they told Dorothy. Exactly. So
anyway, okay. So enough about that. Back to my ring. This is a cool thing. It's a lunar ring, and it's one of those health rings that it monitors all your stuff. You know, your stress level, your steps, your oxygen levels, and it's actually pretty smart. It uses AI to do stuff. So like I'll come back from a run and my phone will ding and it'll say, "Did you just come back from a run?" And you have to say yes. And it does a lot of the same things that my watch does. But what I do like about it is that it monitors my sleep. So whereas I take my watch off at night, I leave the ring on. And it's interesting to find out things about my sleep that I didn't know were happening because I thought I was asleep, but apparently I'm not asleep. But anyway, but what they're able to do in this size, you know, I haven't taken it apart yet, but I'm assuming there's some sort of MCU, there's a Bluetooth transceiver, there's a whole bunch of sensors, and obviously there's a lot of charging and stuff that has to go into a very small space. But that's about how much I do with something like this. But there are people who go way deeper into these sort of, I'll say, tear down / reverse engineering.
Yeah, reverse engineering. You know, people don't realize the percentage of engineering hours that go into reverse engineering in one form or another and for one purpose or another. Sometimes it's just a learning exercise. Sometimes it's how to figure out how to do something better. Sometimes it's how to figure out how to compete with your competition. And sometimes it has to do with, how to make things safer, right? So
Yeah, one of the biggest ones you hit on is that I know people pay reverse engineering specialists to take apart their competitors' devices. That's a real
for
big
sure.
one. But actually, somebody who knows a lot more about reverse engineering than I do, I'll never say they more than you do, because you always surprise me with how much you know. But there's a company called EM Proof, and I think I'm saying that right. And we have on the line Tim Blazitko. He is the chief scientist and head of engineering for EM Proof. How you doing, Tim?
Hey, Rich. Hey, Vin. Thanks. I'm good. How are
Hey,
you?
great.
I'm great, thank you. Did I say the name of the company right? Did I get that right? Is it EM
It
Proof?
was M-proof, but it doesn't matter that much. So yeah.
Okay, so tell us a little bit about what you guys do, and I'd love to get into that a lot deeper.
Well, we are basically a company in Bochum, Germany, where we do firmware hardening for embedded devices. So what we basically do is we build a software product that prevents embedded firmware against reverse engineering attacks.
Very cool, very cool. So if I was to show you my Luna ring, and one of the questions I had for Luna is this thing even running an operating system? What would you be able to tell me about this if you were to take it apart?
Well, if we take it apart, what we would usually do is we start by analyzing the hardware and trying to dump the firmware. And once we have the firmware, we can take a look at this with so-called binary analysis tools or reverse engineering tools like Hydra or Binary Ninja or IDA Pro, where we can basically analyze the data, which represents the code of the ring, the firmware, basically in a software tool, and take it apart and see how its inner working is. So you have to think about it that you basically have a firmware which is just a sequence of bits that is interpreted by the CPU, the underlying hardware. And there are tools for that outside freely available, which basically allow you to decode these instructions into a human readable form of so-called low-level assembly code. And furthermore, this low-level assembly code can be then transformed or approximated towards high-level code, so-called decompilers. With that, you are able to basically analyze the code and get a good understanding of what's going on, and also learn about secrets in the code.
So is this 100% legal? What you're doing? Are you allowed to do what you're doing?
This is a question that depends on the context you're doing it, where in the world you are located, and so on and so on. So in most countries, it is legal for research aspects or for compatibility aspects, or if you want to know if something is trustworthy or not. At the same time, if you do it with the goal of preventing some license checks, some cracking or piracy, that's obviously not legal.
Are you allowed to take apart a product from company A and sell that information to company B, who might be a competitor?
Not directly, absolutely not. But there's a so-called aspect that has been introduced in the 90s, which is known as clean room analysis. There you basically have two teams. One team takes everything apart and writes a detailed documentation of that, and another team works on the documentation and takes it as a starting point to re-implement it on their own. And something like that is considered at least gray area up to legal. So this is commonly done, but taking something apart and re-implementing on your own, this is for sure not legal at all.
Have you ever come across one of these that you got halfway through a project and somebody said, "Hey, are we allowed to do this? Maybe we shouldn't be doing what we're doing."
Well, we not really, because we don't do reverse engineering for customers. We mostly harden their products against reverse engineering. And yeah.
Okay.
So not
How about
so
you,
much.
Ben? You ever do anything like that?
I've never done it for someone who's trying to compete with someone. I have done it.
But you've probably done it just for yourself for fun, right? I mean,
I've done it. I've done it for fun, and I've done it for semiconductor companies who've said, here's a printer or a toaster or whatever. Can you tear it down and do a block diagram for us because they're not using our microcontroller or they're not using our op amp. And we'd like to know if we have parts that we could go to them and say, hey, we can do this cheaper, better, smaller, faster, or something. So the information's been used for marketing, but not directly competing with the product that we did the teardown for. So
was it a requirement that you had to put it back together and how to work again?
It wasn't, but I always took that as a personal challenge to do that. I started out my quote unquote engineering career doing that as a 5-year-old, taking things apart and having to put them back together again in the house. So,
you and everybody else who's in this field probably started
yes,
the same way.
Absolutely,
and your dad was probably yelling at you like my dad was yelling at me, put that thing back together.
Oh yeah, I remember. I still have a vivid memory of the first time I unscrewed the legs from the coffee table in the living room, and they're like, what are you doing? I said, I just wanted to see. So yeah,
what about you, Tim?
This is a very interesting topic because, reverse engineering something mechanical like a table and taking the legs off is pretty easy to see what's going on and pretty easy to see what the next step might be. When you get into electronics, it's a little harder. And when you get into software, it's even harder. So I'd like to find out from you, Tim, if the process of doing it at a high level is roughly the same as if you were a mechanical or electrical system that you're trying to reverse engineer, or are you doing some things that are specific to the software engineering domain?
Well, it's a mixture of both. I think on the high level, it follows similar strategies or similar ideas or approaches, but the tools you work with and the level you work with is entirely different. So basically, I think you have a common goal, like you have a finished product in front of you and you don't know what does it do, how does it work, and you have to basically dissect it into layers, understand it layer by layer, look what's important. You have to know the background, how can something like that, basically what happened during engineering such that it looks like that. So you have to know that. And basically, in engineering, you write your high-level source code, you put it into your compiler, and you got your firmware, basically. And you have to understand what does a compiler do, how is high-level code represented in the low level, and stuff like that. But then you start digging up your tools that dissect different layers from that. You take a look at the lowest level, get a partial understanding of that, a partial understanding of that, partial understanding of that. You have a working block in mind, like how you would have it done as a high-level engineer. You think, oh, this might relate to that, this might relate to that. So you're doing a lot of educated guesses and put together piece by piece a small puzzle that becomes larger and larger until you have a clear picture at some point in time. So yes, I think this is a pretty comparable approach. You just work on different levels with different tools.
What are the tools that you typically use?
So we basically use so-called software-based reverse engineering tools like interactive disassemblers and decompilers. And there are 3 major tools out there like IDA, Binary Ninja, and Ghidra. And I think Ghidra is pretty interesting because it is an entirely free open source tool and one of the industry standards, which is released by NSA. So basically allowing Ghidra, since given that it is free, it allows basically everybody to download it on the website, to put in arbitrary binaries and just play around with that. People won't understand much of the low-level representations, but if you are familiar with C or C-like languages, you will at least get some glimpse about what the code might be doing based on its decompiler output.
Why would the NSA be involved in something like this?
Well, it's the first tools like that have been released mid to late 90s, and it became basically industry standard. And also secret agencies, of course, need to have tools like that and analyze binaries because they want to know if something is trustworthy or not, what a piece of software or a piece of hardware does, what embedded microcontroller does, and also potentially from an offensive point of view, if there are any bugs inside. And so for that, you need some kind of tooling. And therefore, NSA started developing their tooling in-house. And I think it was 2019 where they released it to the public. And why they exactly made it open source, there are many reasons for that. None of them is really confirmed as to be the one reason, but it's probably because they want to share and give something back to the world, make it more accessible for outsiders, but at the same time make it easier to onboard new people which already know their internal tools.
Right. That makes a lot of sense.
Yeah.
So
But
one thing
we
that
can
comes.
see it.
Go ahead. Sorry. Go ahead.
We can see it like 2019 when Ghidra has been released. It was an absolute game changer because then you had one free open source tool for everybody who could basically join into the market without and digging up binaries. And this changed a lot of things because there was some open source competition in, at that time, heavily commercial market.
So before that was released, were people making their own tools or they were just doing everything by hand?
No, there have been tools, but this was mostly related to one or two commercial tools like IDA Pro and Binary Ninja, who basically have and also had at that time some limited free versions, but most of the most architectures and stuff like that were basically hidden behind behind paywalls, so that everybody could not really dive deep into that. And with the NSA tooling, basically everybody is now possible to analyze every possible architecture out there.
Cool. So, in hearing you describe this process, my entrepreneur hat popped on, and I have to ask you a couple of questions, which is, the first one is, what you're doing sounds really cool, and how many people in the world actually do that? What's your competitive market like? And the other is, it seems like you don't know what you're getting into until you get into it. So as a company, how do you price a project when somebody comes to you and says, I'd like you to reverse engineer this? How do you know what to charge? Or do you just say, I'll do it by the hour and I'll let you know when I'm done?
These are pretty good questions. Let me answer the second question first. So basically, how do we charge that? Well, we basically do not do reverse engineering. We basically build anti-reverse engineering techniques, like we harden firmware against reverse engineering. So this is a different market. But there are people out there who do a lot of reverse engineering for that, and they are pretty expensive in many cases, because reverse engineering first takes a lot of know-how, which is not much out there, and at the same time it's very time consuming, especially if you're very concrete questions like, how does this work in detail? So like, let's say we have a small microcontroller and you have very specific questions how a specific algorithm works, and you need a re-implementation of that. This usually can take up to several weeks full time to come up with something like that. And given that this community is small means that there are maybe a few thousand people out there, maybe a few 10,000 if you think globally, but I would say more about a few thousands out there. It's like the special conferences are pretty small. So then you can think about that, how much time effort versus how much knowledge is required, so that these things can get pretty expensive.
Okay, cool. Thank you.
Any interesting stories, Tim? Anything that when you've done some of this reverse engineering work that you said, oh my God, look what these guys did?
Yeah, we often see a lot of things that we thought, oh, this shouldn't be in there. Like, especially if we look into embedded binaries, we see a lot of hard-coded cryptographic keys, like private RSA keys or symmetric AES keys, which are hard-coded there because people don't know better, or they need to hard-code it because they are enforced to by common standards or something like that, and then they have no way to encoded. But yeah, looking into a binary and finding cryptographic keys in plain text is a large attack potential, because you can just reuse the keys, break the ciphers, and stuff like that, decrypt some data. There's also a funny thing we found. It's also, especially on small IoT devices, that they often talk back to the cloud and upload data or something like that. And it's not uncommon that that you find hard-coded credentials like username and passwords encoded in plain text into binaries. And once you have something like that, let's say you have a small GPS tracker which automatically sends the GPS locations back to the cloud. Once you have these credentials because you looked into the firmware, you could basically just take the credentials, take your own Amazon client or write a small script and basically put in your credentials there and then access the cloud and download all the data. And many companies basically then think, well, my data is hard-coded there, but nobody can access it. So we don't have to take care about much network security or do not have to separate cloud data and stuff like that. So it might happen that you, once you have the cloud credentials, can download all the information from all kind of sensors out there. And this is something which is not that uncommon. And this is very funny and shocking to see at the same time.
Very funny, huh? You got a weird sense of humor.
Yeah, well, if you do a lot of offensive security, you see strange things, and then you have to be happy about them.
Very true. Very true.
You have to be happy about them.
You know, especially in the military sector, in the defense sector, in the offense sector, you do a lot of reverse engineering with the goal to look into other people's stuff, understand how things work, and especially how you can attack them. Like, is there a logic bug that you can use to basically take over some data or take over control or disrupt other services? For instance, we've seen that when the Ukraine war started, we saw that Russia made a large cyber attack on the satellite communication infrastructure in Ukraine by basically doing a large-scale attack to shut down the communication there. And something like that is done via offensive reverse engineering. You basically take a look at critical firmware, analyze how it works, and then derive strategies how you can attack that.
Wow. Yeah, that one's not funny. Interesting.
Yeah, it's absolutely not, isn't.
So you have any advice for our audience, people who want to be amateur reverse engineers?
Yes. Well, I would recommend them go to the Ghidra website, download the software, and play a bit around with that and load in some arbitrary binaries. I also do for Improve a webinar series where I basically dig into the details, like 101 reverse engineering, where to start, how it works, explain it. So there's also something to watch up for others if they want to play around with that.
See that? We got a plug in for Improof without even knowing.
There you go.
Good job.
Yeah,
Tim.
we should put both of those links on the site with this with this podcast.
Very true. Very true.
Great.
This is very interesting, Tim. We could probably hear war stories from you all day. I probably shouldn't say war stories. That was bad. Stories in anyway. Thank you very much for joining us, Tim. We appreciate you taking the time.
Thanks, Tim. Appreciate that.
Thanks, Rich and Vince, for having me. It was great to talk to you.
Great to talk to you too.
That was Tim Blazitko from Improof. What'd you think, Vin?
I think that was great, and I'm inspired. I'm going to go take my espresso machine apart now.
You bet. Darn well better get that sucker back together. You're going to have some unhappy people.
Gail doesn't drink coffee, so the only way she would allow me to spend that much money was we have to call it the hot beverage center instead of the coffee machine because she can get hot water for her tea. So we actually call it the HBC, the hot beverage center.
Very good. Very good. Well, good luck with that. This has been Dev Talk with Rich and Vin, and we will see you all next time.
Bye-bye, everybody.
Thanks for listening to this edition of Embedded Insiders. For more daily news, videos, and podcasts, visit our website at embeddedcomputing.com.